Okay, hi everyone. Good evening. So my name is Saher, and I'm also a resident at University Hospitals in Cleveland. Thank you again for the opportunity to present today. I might cover some of the information that we kind of just talked about. I have no disclosures. These are the other authors' disclosures listed. Okay, so peroral endoscopic myotomy is very frequently cited to have over a 90% clinical response rate. There are reported risk factors for failure that include high preoperative Eckhart score, esophageal tortuosity and dilation, like we were just talking about, non-type 2 achalasia, unintentional mucosal injury, young patient age, and low surgeon experience. The procedure can theoretically be further complicated by prior endoscopic treatments, as this may increase the level of fibrosis in the musculature. So although POEM has been found to be similarly effective in treatment-naive patients and patients that have been previously treated, symptom recurrence has rarely been assessed separately from immediate clinical response. So our aim was to assess if patients with prior endoscopic intervention, such as Botox or dilation, had a higher likelihood of recurrence. So this is a retrospective chart review from a single tertiary care institution of all POEM patients that underwent POEM for achalasia by a single surgeon between 2011 and 2012. I excluded all patients that had a prior myotomy, either Heller or POEM, or patients that had missing data on prior procedural information. A primary outcome of interest was symptom recurrence and reintervention after immediate clinical response, which was defined by a postoperative Eckhart score as 3 or less. So the remaining patients were stratified into cohorts for treatment-naive patients, patients that underwent a single prior endoscopic intervention, and patients that underwent multiple prior interventions. Multivariable logistic regression was performed to assess whether these were predictors of recurrence. And so in the end, we had a total of 164 patients that were included, 90 that were treatment-naive, 34 patients that had single prior intervention, and 40 patients that had multiple prior intervention. So there were no differences in any demographic factors in achalasia type or in preoperative Eckhart score or unintentional mucosal injury. There was a difference in the distribution of symptom duration amongst the patients in the cohort and in surgeon experience, which kind of implies that despite increased surgeon experience, patients continue to undergo other endoscopic treatments prior to referral. Otherwise, single and multiple prior endoscopic treatment were not associated with recurrence in multivariable analysis. Preoperative Eckhart score of 8 or higher was the closest factor to being associated, but this also did not achieve any kind of statistical significance, and no other factors achieved any statistical significance. So in conclusion, prior endoscopic intervention did not predict symptom recurrence or intervention following POEM, which is different than what we've seen in Heller myotomy in the literature. So patients can be treated with POEM regardless of previous endoscopic treatments. Thank you.